Katy Lees, Principal 340B Compliance Advisor with Virtue 340B. Welcome to Katy's 340B Compass. If you are a returning listener or viewer, welcome back. If this is your first time, I hope you enjoy. Today I am going to talk about telling your 340B story. I recently had the opportunity to discuss this topic on a panel at the Becker's Chief Pharmacy Officer Conference, and it seemed like it was really well received. We got positive feedback, and it is an important topic. So I thought I would bring it here, so we could talk about what it means to me to tell your 340B story. But essentially, telling your 340B story is making sure that internal and external stakeholders know what the 340B program means to you, or means to your organization, I should say. It's not, we all know 340B is complex. It's not an easy thing to talk about. It's not an easy topic to educate people on. So, there's not like a quick, I've been in this program for a very long time, and I've yet to really perfect that elevator speech. There's not quick, easy sound bites saying bad things about the program. It seems a lot easier to kind of create those, quick, easy sound bites and narratives. Not quite so easy to do it the other way. So it takes some, it's a thoughtful process. When I was on the panel, another person that was participating with me, she used a great term, and I'm going to steal it here, and I have to give Madeline credit. I stole this from her while we were speaking together in Chicago, but telling what is that social ROI of your 340B program? How are you reinvesting your 340B savings or your 340B benefit back into your community? This is what you're telling. This is that story that you need to put together. And again, it doesn't happen overnight. This is a process. This is something that you're working on a daily basis, in my opinion, at least. You are building credibility by managing a program with integrity, by understanding your program, by all of the communications you have with all stakeholders within the 340B space. And you're building relationships, that's all kind of comes together, building that credibility, building those relationships so that, not only do you have a path to tell your story, but it's a believable one. You are coming from a place that they know that you know what you're talking about, and that they know that, you're administering a program of integrity. This is also just, again, that communication, that routine, those relationship building, that also makes it a little bit easier to tell your story when you're always working on that program education, because it is so complicated. If you work with your lawmakers, if they're having conversations about 340B, you can't just show up one day when you need something. A law was introduced, you need their support on it. That's not the day to show up and tell them, oh yeah, actually we participate in this program. It's called 340B. It means a lot to us. No, they should have this information. They should know, they should have some baseline of, this is what the 340B program is. This is what it represents for our organization. That should be a routine part of the conversations that your government relations team or whomever meets with these, state and federal lawmakers. It should be a routine topic that comes up, even if it's just a quick touch base or just a quick mention, building that foundation so that you have that relationship established when you do need something, when there is a law that you want their support on, or a proposed legislation that you want their support on, or there's some sort of critical thing that's happening and you need them to send a letter to HRSA or to someone. That's when they already have they know your 340B story, because you've been building that over time. And so what is your 340B story? How do you come up with that? Again, you need to know your program. You need to know what the value of the 340B brings to your program. And, this comes in a couple ways. There might be some revenue generated, if you own pharmacies. Well, I can't even say that if you own pharmacies, because even if you own the pharmacies, you're buying the drug at a discounted cost. And that's largely what the 340B benefit is that you're able to purchase drugs at a discounted rate. So it's not that you are bringing in these financials and, you can see it within your your accounting system, and then there's a line to where that money goes back out again. You just didn't spend the money. You spent less on the drug. There is some revenue, as I said, so like a contract pharmacy arrangement, that wouldn't be in place likely if you didn't participate in the 340B program. And that is going to come in certain ways that, could be considered revenue. So there is that to some degree, but for the most part, you're just saving money. My former chief pharmacy officer liked to, put it in terms of if I go buy a car and I save $4,000, they take $4,000 off the cost of the car. And then someone wants to audit me on what I did with that $4,000. Like, I don't know. Like, chances are I did not go out and say, I have $4,000, I'm going to buy this. No, I just didn't spend $4,000 on the car. So I had $4,000 to spend on my groceries or my utility bill, or maybe I splurged and bought myself, a nice purse or something. But there's not a direct line of what you did with money that you didn't spend somewhere else. So it certainly is complicated. So that's where that social ROI comes in, is making sure that you, again, understand the value that the program brings, because that is semi-tangible. You need to be able to calculate those savings. But then translating that into how are we reinvesting that money that we didn't spend because we participate in the 340B program? Know your community. You need to know your community. I'm sure, as an organization, depending on the size of your entity, what entity type you are, you're probably a core part of that, supporting that community and supporting their health and different aspects of these, the lives of the people that live in your area. So how is the 340B program benefiting that? Think about what programs exist or are, able to be expanded because of the 340B program. Everyone has this story. It's just how you can put it together. Maybe it's not just a pharmacy program. I'll talk about a couple pharmacy specific things, but that's one thing to remember. This is not just pharmacy specific, but there certainly are benefits that are, involving the pharmacy. So because you participate in the 340B program, you likely, give free or discounted medications to patients. I think in hospitals, I don't know if it's common, but something that some hospitals are able to do because they participate in the program is ensure that all patients upon discharge are leaving with the medications that they need to leave with to hopefully reduce their chances of being readmitted. So, sometimes it's referred to a meds to beds program. Before a patient is discharged, the in-house pharmacy, or maybe it's not an in-house, maybe it's an external pharmacy, is filling the prescriptions that that patient needs to bring home, and they're delivered to their bedside. So when they leave the hospital, they are leaving with those medications. And if they can't pay for it, they're leaving with them anyway, because it's the hospital is invested in their care and going to make sure that they can leave the hospital with the prescriptions that they need. There's a lot of issues, I'll say, in the area that I live. Rochester, New York has a pharmacy desert. The pharmacies are closing. A lot of the big chain pharmacies have had to leave the area. So, there's pharmacies in this area that are able to remain open because they're part of covered entities that participate in the 340B program, and they deliver prescriptions to patients across the city because this is a very poor city and they need to receive their medications, and transportation is often a barrier. So the pharmacies are having to, and this is not, unique to Rochester by any means, but the pharmacy might be delivering 50% of their prescriptions to patients to get them across multiple zip codes across the city or the county. And there's no cost added to the prescriptions. That's at no cost to the patient. It's just the covered entity invested in making sure the patients get the prescriptions that they need. So they are covering the cost to get those to their homes, whether it be, a delivery driver or through the mail. Again, non-pharmacy specific programs that to think about. Again, I'm just giving examples of things just to get everyone's mind going of let me think about all of the things that the 340B program might be benefiting at, each individual organization. mental health programs, substance abuse programs, infusion care, pediatric care. These are things in healthcare that commonly don't have, the revenue to support the services. The reimbursement just is not aligned with the care that's being provided. So, it's these types of programs and many, many more that are able to be supplemented by the 340B program. Hospitals or covered entities are able to sustain these programs even at a loss because they're able to subsidize it with savings from the 340B program. Maybe even things like transitional housing, transportation for patients to make sure that they are getting to their appointments. Maybe nutrition assistance. The sky is the limit. Like, healthcare is not limited to one, small scope or classification. There's so many things that hospitals and health centers are doing for patients and communities across the country that are being subsidized by participation in the 340B program. So, within your organization, bring together, if you're struggling to tell your 340B story or to write your 340B story, you need to, it's not easy. As I said, it's a process. You need to find the right people within your organization. And this might be individuals from many different departments to just, again, bring all of this information together to understand. And it's not going to happen overnight. You can't sit here and by next week, I need to be able to tell this whole story because I'm meeting with a lawmaker and I need to go in there with a piece of paper that shows all the things that 340B does for us. Like, that's going to be really challenging. This is going to take some time. That story will continue to evolve for you. But if you follow, some of these steps and just really start thinking about, first starting with, what does the 340B program mean to us? Think about, if we didn't have those savings, if we paid that much more for our drugs, like, what would that mean for us? What services would we likely or possibly need to cut? Those should be in your story. You're probably not going to be able to deliver prescriptions all across the county if you're just losing money just filling the prescription itself. You might not, if you have a mental health clinic that just routinely is only making, returning 50% of the reimbursement covers 50% of the services provided. Like that, if there's no other area to subsidize that, can your organization sustain that? So these are things that you should be thinking about, like when you're trying to build your 340B story. And it's so important to tell this story. Again, it's just, we're living in a world where there's a lot of noise about the 340B program, a lot of misinformation about the 340B program. And, the people that are not in support of it, it's easier for them to tell this story. Because that is pretty simple, these, stories that are being told. But this, each individual organization being able to come forward and just support what they are doing for the community, help people understand, whether, again, that be people within their organization. Maybe it's not patients. We don't talk about this as much publicly. We can, you certainly can. But again, it's just complicated. But at the very least, your lawmakers need to hear about this. Whether it be at the state level, this has always been a federal program, but I think everyone probably knows at this point, it has very much become a hot topic in most states. So really it's your state and your federal lawmakers that need to hear from you so that we can, find some stability and some sustainability in the 340B program. Maybe we can offset some of those negative narratives that are out there. It's very important to tell your 340B story and just take your time, put it together, mindfully, and don't feel like you have to just like have a finished product right off the bat. It really is a daily It's a process that's going to happen on a daily basis. It's how you administer your program. It's building that credibility as a 340B covered entity, building those relationships with, everyone internally at your organization, helping them to understand what the 340B program is, how it benefits your organization, how it benefits your community. And then, once you have that, you're able to speak to that to some level, take that external, make sure that your lawmakers know this. If you're interacting, if you have a reason to interact with HRSA, it's very important too. Like, you might need some of this information if you are, need to advocate for a registration that they may have questions, or just even with speaking with HRSA, this type of information could be important. When you're interacting with manufacturers, just again, building that credibility, building those relationships, or sometimes they might also want to hear from you of why you're doing something, which we won't get into all of communication back and forth with manufacturers, but just at a local level, it certainly could be part of the conversation. I hope that you all found this helpful, and I look forward to speaking to you again soon. Thanks. Bye. Do you have a 340B compliance question? Send us a message at virtue340b.com. Thanks for tuning in, and we will see you on the next episode for more expert 340B advice. Talk to you soon.